Yes, we've come to the thank yous. It's been an amazing 2 days. Thank you all for your remarkable inputs and sharing. I will take this opportunity to thank first the government of Malaysia for gracefully hosting BICON 2025 here in Kuala Lumpur. I would also like to thank all our Malaysian friends here for their hospitality. We're thankful for UNICEF Malaysia, who joined us at the BICON 2025 Organizing Committee and will help to make BICON a great success. I would like to have a shout out to our partners at the Martin James Foundation, who have been by our side for the last 2 BICONs, and Weeshuis der Doopsgezinden, who came on board this year. That's a difficult word, it's in Dutch. Also a big thank you to the organizations who have helped support participation, such as Keystone Human Services, the Global Foundation for Care Fellows by Experience, the Miracle Foundation, and others. A special thank you to Dr. Kiran Modi and Udayan Care, who have founded BICON. Also, Forget Me Not Nepal, who hosted the previous BICON in Kathmandu, Family for Every Child, SOS Children's Villages, and of course my fabulous colleagues at Hope and Homes for Children. I would also like to thank the dignitaries from the governments of Cambodia, Philippines, India, Bangladesh, and of course Malaysia. We all know how important the involvement of government is to make real change happen. A big thank you also to Dr. Rinchen Chopel and Mikiko Otani for your ongoing support and involvement. Thank you very much. But most of all, I would like to thank the young people in the Coordination Committee and the Care Leavers Reference Group. They have shaped BICON 2025, and as always, their takeover session was the most powerful of all, and one who will stay with us for the longest time. One of my colleagues, Pete Garrett, asked me earlier, can the name of the BICON Care Experience Reference Group be changed to BICON Care Experienced Leadership Group? Up to you. To close BICON, I would like to invite 2 people on the stage here with me who will help sum the days up for us. First of all, Albert Justin, who is a Care Experience Assistant Manager Youth Program at the Miracle Foundation India. Albert's journey from being a care leaver at CCI in Trichy to becoming a youth ambassador for Miracle Foundation India is incredible. His passion for change has led him to participate in international conventions, conduct youth-led webinars, and represent children and youth in global board meetings. Today, as a math teacher at an international school, he is transforming lives in the classroom and is impacting the world with his dedication and hard work. And he has a family of his own now with a 6-year-old son. Albert, please come. The next person I would like to introduce is Miss Mikiko Otani, who has been, as I said earlier, a long-standing friend of BICON. I believe she's been introduced several times already, but I will keep it short. She was elected to the Child Rights Connect Executive Committee and as president of the network in June 2024. Before that, she was the chair of the UN Committee on the Rights of the Child. And she's an international human rights lawyer based in Tokyo, where she has been practicing family law. Mikiko, please. Thank you. Let's see if yours works. Yes, very good. I've asked you earlier to reflect on this morning's session and all the work that has gone into that. And I would like you to share a little bit about how that was for you and how the process was, what was shared even outside of this room.
Good evening, everyone. First of all, I want to thank on behalf of care experienced persons, the total BICON organizing committee, family for every child, Forget Me Not, Hope and Homes for Child, SOS Children's, Udayan Care, UNICEF Malaysia, Martin James Foundation, Keystone, and Miracle Foundation India. Those are all gave us or support us to participate in this international platform. Thank you all. And yeah. Actually, in the fifth BICON, we have tabled many problems, the challenges which we faced. We have given recommendations. Over these 2 years, we have seen many improvements. We have seen many good practices happening across the world, across the Asian countries. That only we have discussed, we have said here as a good practices. As I mentioned in that one of the video, we have built everything, but still some patchworks are there. That's only we have given as a gaps. Still some gaps are there. So that social workers can be equipped them to correct that patchwork, that gaps, to address the gaps. That is a main sharing. Then second, they have mentioned, they have highlighted issues around the education. Still there is a problem. Till 18 years, till they are in the CCI, they have supported. When they are going out of the CCI, only few organizations, few governments are supporting for aftercare programs. So there is a gap in the education and housing facilities as well. Then success of peer support in care leavers networks, really it is, they are doing amazing job. That is tabled here. Because each and every country having different care leaver network, and they are working with the government also. Really in the Sri Lanka, they are started working with the government. Really it's a great thing. From them, what we have learned from other care leaver networks, we have to tie up with the government, with the CSOs for the scalable things. Really it's very important. That is said here. Then they have stressed the importance of recognition and inclusion of the care leavers in the policy making. So these are all the important points said here.
Thank you. Thank you. That's really powerful. Thanks. I was also wondering if there is anything that you as a reference group have learned over the last 2 days. Is there anything that has come up in your discussions?
Yes, as I mentioned, policy is developed. CSOs, governments started making partnerships. They are trying to implement. Still, in the system, there is a problems are there. That needs to be addressed. That will take some time. We have to accept it. All of a sudden, it cannot reach the entire country to the village level, the remote areas. We need to understand the problems. Systemic barriers are there, but still that needs to be addressed as soon as possible.
Thank you.
Yeah.
Is there anything in specific that you think that should be taken forward? I mean, we have a lot of key recommendations, but looking back at BICON 2025, is there one particular point that you think that should be taken forward? And I know that you're speaking on behalf of the whole group.
3 important points. Developing a sustainable care leaver networks, national wide, not from the specific district, not in the specific state. They have to represent as a national level so that they can discuss or they can solve many issues. If they are only from the state specific, that their problem may be different. So the same problem may occur in the other state or other part of that country. So when they are discussing in a common forum, when they are discussing in the care leavers network itself, they can start solving easily. Then we are recommending, many places don't have aftercare centers. So what we are taken as a forward of thing, we have to initiate the state, each district should have a aftercare centers. In many places, per state, 1 or 2 centers are there. But if you are counting the CCIs, hundreds and hundreds of CCIs are there. But aftercare, only 1 or 2 out of 30 district, only one will be having aftercare centers. So that is very difficult to accommodate many children, young adults. So every district should have aftercare center. Then a regular capacity building for the social workers, because day by day the problems are emerging differently for the young adults. So social workers also need to be equipped to handle these difficult situations. Then continued collaboration between CSOs, governments and young adults to create a sustainable youth programs for the young leaders.
Thank you so much. Thank you.
Thank you.
And lastly, we've had several governments here in the room presenting, giving very powerful speeches. Is there anything that you would like to say and would like to get as a hard commitment from these governments and from participants in the room? What would that be?
This is a very important point, and I want to table it here. In the recommendations also we have mentioned that. Actually, instead of giving fish, we have to teach them how to fish. By using this, instead of giving money, we can give them a stable job so that they can earn on their own, they can spend and they can do whatever they want. Instead of giving money, government can do this, can give the reservations in the government jobs. Because in across the world, government jobs are considered as a safety place. Till 60, till the retirement, we can sustain in that job. That is a job security. So, reservations. Reservation, I am not saying that 100%. Because care leavers or young adults are trying to study the competitive exams. But still, after their courses, they have to go for a job. They are struggling to crack that exams. Even though they are, if they are going for a work, hardly they will be having 2 hours, 3 hours to study for the competitive exams. If the normal cutoff is 100 out of 150, if they are scoring 80, 90, they are struggling to get the jobs. So in that places, if we have a reservations, they can secure their job easily and they can guide. And government have to provide that coaching facilities to score good marks, and the housing facility, because CSOs can support only the limited places, districts. But if government thinks, government is functioning and even in the remote places, they have to plan for the housing, subsidized housing schemes, especially for care leavers. And special educational scholarships, skill training, job placements. This is that request for the governments.
Thank you. Thank you very much. And just to point out that you spoke on behalf of everyone else in your group. Mikiko, can I please accompany you to the stage and ask you to share your sum up of the last 2 days Thank you so much.
Thank you very much for giving me this privilege to speak at the end of the conference. I am truly, wholeheartedly grateful for the organizers for this sixth BICON and also the invitation for me to be able to attend this very important conference together with Dr. Lin-chan, my good best friend in the committee, though I left the committee. I thought throughout the 2 days what I'm going to say because I know I'm giving this opportunity to speak, to share my reflections. I thought again and again and again, and I decided to share 3 points as my reflections. I will not try to summarize what we discussed because all are reflected in the recommendations. And I understand that we will receive some reports from the BICON later on. I would like to start saying, sharing with you my first engagement with the BICON. I was invited to speak at the BICON in 2021. It was during the COVID time, and I was chair of the UN Committee on the Rights of the Child. I didn't know actually the BICON, and the invitation came through Dr. Lin-chan. So thank you so much, Dr. Lin-chan, to put me in contact with this wonderful community, I would say. And and it was actually after the committee's Day of General Discussion on Alternative Care and Child Rights in 2021. So it was after DGD. And I spoke at the BICON 2021 as a keynote speaker in opening session. And now I realize that I missed great opportunity to meet with the all participants, including the young people, caregivers in that BICON, because I spoke in the opening session as a keynote speaker and left. I regret now. I should have stayed on and listened to all these wonderful inputs and sharing the stories. So this is my first engagement with the BICON. So now I'm going to share 3 points. Number 1, I observed very strong the partnership with the young caregivers. Caregivers at the center shaping this BICON. And I'd like to again thankful to all the 34 young caregivers to come from the 7 countries and the organizing committee. Congratulations to the organizing committee to have the caregivers really at the center. This 2 days conference started from the very powerful 2 young caregivers opening statement. And we heard again and again and again their voices. And I understand that you are saying that you don't want to be just heard. You emphasize that you want to be part of the decision making. We heard your voice very seriously, very clearly. But at the same time, I want to share my perspective. You say that your stories, but it's not just the stories and experiences. It's so inspiring. And it's so convincing and motivating us who want to work for the children. I'm saying this because I'm very often invited to speak about the international framework or global framework. And of course, my role is because of my position as a former member and the chair of the Committee on the Rights of the Child, I very often speak about what the convention says and what the committee says and what the global guideline says. This is my very often the responsibilities. We know all that the Convention on the Rights of the Child is a legally binding document. All what we discussed over 2 days are everything in the convention. We heard the family is the foundation. The child has a right to grow up in a family, right to identity. The child has a right to be cared by the parents, not be separated from the parents. And the governments have a responsibility to provide alternative care, but family-based care family-based care should be in the first place, and not the institutions come to the first. We all learned from the convention. However, sometimes I see, although the convention is a powerful tool because it's a legally binding document, but we need to have the heart in this legally binding document. And this is what you shared, your stories. So what I heard from you, your experience, very often common challenges, but I heard each one of you has a different story, and it's your own individual story, which will stay on in my heart whenever I speak about this topic. It's not just dry legal document which was adopted by the United Nations General Assembly, which itself is very important. However, now I see your face and your stories in the legal document text. So thank you very much. And I heard, thank you very much. I sensed it's not so easy for you to share your stories, and thank you so much for your courage. And I felt so touched because you shared your stories because you care about all the children still living in the institutions. You said that you cannot change the past, but you can change the future. And you care about still the children who are still in the institutions. So you are using your voice and opportunity to share your stories to convince us we have to do more. So it was so powerful, and thank you so much. And you talked a lot about the empathy and solidarity, but you showed by your sharing your stories and telling us all your ideas and appealing to us how you are using your power of empathy for every children still in their care. And also I'm so impressed because I understand that when you share your stories, I see the pain. And also I'm very impressed this morning when I heard you are powerful leaders and professionals, but I heard this morning, but don't tell all those children in the institutions to be powerful leaders or professionals, but to be a better person, to be a better citizens. And I sense that to be a good person sounds very simple. However, itself, it's very, very challenging. So what kind of experience you have gone through? And so we know a lot, as legal term, right to identity, right to grow up in the family. But you put the heart in those legal documents, what it means to children and young people who experienced residential care, and what happens to you, and what it means if you don't have a family environment, how it is impacting your whole life and even intergenerationally. So thank you very much. So my heartfelt and deep appreciation to the young people who shared your stories, not just the storytelling, but to make the change and bring the impact in a real sense through the policy change and reform. My second point is we know what we need to do. I think, I hope we agree that we know what has to be done. We talked a lot what is needed, and so the Convention on the Rights of the Child was adopted in 1989, and the committee started working in 1991. And then committee started organizing the Day of General Discussion to focus on some themes. And in 2005, the committee felt that alternative care is the theme the committee need to address. So the Day of General Discussion was dedicated to the theme alternative care, and some recommendations came from, and one of the recommendations was that we need the guidance on alternative care, so which led to the adoption of United Nations General Assembly Alternative Care Guideline in 2009. Then we still continue to discuss what should be done, and committee decided a second day of general discussion on this theme in 2021. That was, in my view, the very much change happened because the caregiver came to tell the committee that you need to hear us. So it was, I think, a very strong point of change. But since then, we heard from them what is needed. And we know what is needed now. Prevention, support for family, addressing root causes, including poverty, need to involve community, partnership, collaboration, mental health, support for caregivers, social service workforce, and data collection, gatekeeping, monitoring, we all know. Now, I think, yes, we discussed a lot, and the young caregivers are telling us change, action, implementation. I think it is really the time for us to work together. And I heard again and again very important terms such as co-leadership, co-partnership, and it was so powerful to hear from young leaders, join us. So you are already, leading ahead, and it's not so much for us to invite you to tell us and share your ideas. You are the co-partners, and we should work together with you. So now it's a time, really, I'm maybe saying the obvious, but it's a time for implementation, action, real change, and as monitoring what we actually achieve by this kind of discussion. And in this connection, I wanted to share one of my thoughts about power holders, because I participate in submitting my comments to response to 3 questions from the organizing committee. And the third question was message to power holders. And I thought power holders, yes, the governments have the powers because we need the law reform, policy reform, we need allocation of government budget, we need care management system, we need data collection system, monitoring, we need the government. Your power need to be used. So you are the leadership to take lead. However, I want to share my thoughts. Government, you are not alone. We are looking at you, your leadership, but we are all partners. And I believe all of us, coming from different sectors with different hats, have many ways or different forms of power, such as a former member of the committee now, I'm no longer in the committee, but when I was in the committee, I always felt the committee members have the power of voice. We speak using the legal documents such as the Convention on the Rights of the Child. So the committee members should spread the the word, using our voice. Civil society have the power because you have the experience of practice or the technical expertise. Practitioners have, of course, the power of experience and practice. Philanthropy has the power to use, it's not just to give the money, as we discussed and we heard in the session yesterday. It can change, it can create the social change through philanthropy. And then, young caregivers, you have the power. I saw this morning when we were asked what kind of word we think of you. I also wrote, and I saw power, powerful. You have the power, really. And also I just heard before me and Justin that no one can achieve alone. Yes, I agree. But we can achieve together. I think this is the power of working together. So this is my second point. Third point is about the future of the BICON. I checked my email actually this morning to see, just to check what was my first engagement with BICON. And as I said, it was 2021. But when I searched, put the BICON in my search of emails, so many emails came up, not only for this 6th BICON, but in the past. And then I remembered, oh, actually, I spoke in the BICON 2021, and then I spoke at the BICON Roundtable in 2022, and I spoke in BICON 2023. And so I was surprised myself, and this is my first time to participate in BICON in person. Though my participation was very limited in the past, only online, so I didn't see the whole face of who are gathering, but I am so amazed to see, yes, this is such a wonderful platform. Led by civil society, but now we have practitioners, UNICEF, and the government participants, and the committee members. It's really wonderful. I really want to congratulate how the BICON grew in the past. But now I want to say about the BICON, future of the BICON. I think we talk very often about the global framework, such as the convention, alternative care guidelines. And this is my maybe prejudice perception, but we tend to think that we, align our national law policy with the global framework. Something like global framework is high. Yes, it is true, because like convention and alternative care guidelines were all adopted by the UN General Assembly. However, what is very important is actually already we know implementation. And I think you should be proud of this platform, talking about more, action-oriented discussion. Yes, we shouldn't continue to just discuss and discuss, but in my view, discussion still is needed. Because, not just for talking, because we continue to motivate ourselves, we continue to reaffirm, and we continue to be convinced ourselves, though we know that every child deserves a family. It's a very simple sentence, but it's not, at the same time, it's not so easy. So we need to join hands and collaborate and continue. It's not just a one-day event. So I really want to say that I hope that BICON will continue and having more and more the caregivers and having real partnership with the caregivers to support what they want to say, and because they know they have ideas, and so though the challenges are there, but let's work together with the all together in partnership, and in particular with the young caregivers, because they know from their experiences what is needed and what works and what doesn't work. So I am so privileged. I feel so grateful to be part of BICON community. Yesterday I heard somebody to say BICON family. I feel so privileged, and my humble suggestion to invite always CRC committee members to participate in BICON. It's so powerful. This is my personal suggestions. It's much more powerful to bring them here and hear again and again the very strong voice from young carer and from young caregivers and from all of you, rather than going to Geneva. So that's my view, and of course you will be welcome to come to Geneva, but I think it's so important for them to know this is such a wonderful platform growing in Asia, and my final hope is the continuation of this collaboration and conversation at the regional level, but also at national level. I apologize my bad moderation of the last session. I couldn't take up many more questions, but I hope that those questions will be shared and the conversation between governments and the young people who have a lived care experience and civil society to continue to have the dialogue at the national level. And as Lin Chun said, and also emphasized by caregiver this morning, monitoring what we are going to actually achieve from this conversation at the BICON. So I hope I can participate in the next BICON. And so thank you very much again, and wholehearted thank to the organizers, Government of Malaysia and UNICEF Malaysia and all the partners. I cannot repeat, but thank you very much, and in particular to the young caregivers who shared your very powerful stories with us. Thank you.
Thank you very much, both wonderful speakers. Thank you for closing this, summing this up so well. I now declare BICON 2025 officially closed. But watch out for videos on social media in the coming weeks. We aim to publish the final formal report by the end of December. But BICON is not what happens in this room. It's what happens out there. So keep on talking, spread the word, and make sure that all children can grow up in families. Thank you.